I'm Dr. Scott Perry, and I'm the head of Neurosciences and the director of the Institute for Mind Health at Cook Children's. I also serve as the vice president of faculty development for the Cook Children's Physician Network. And I've been at Cook for 16 years now. I got into medicine, I don't know, you go back to the fifth grade. In the fifth grade, I was going to be an astronaut, no doubt. And I went to space camp. And I found out at the time that I was not going to be able to be shuttle commander because I didn't have perfect vision. And if you know me, then you know that if I'm not going to be shuttle commander, it's probably not the gig for me. So I decided I better find something else that was challenging to do. So medicine just was that thing, I guess, you know. I live in a small town in Mississippi. You got docs that were like, you know, the main people of the city that kind of, you know, helped take care of everybody, and they had a real challenging job, and I liked math and science, and that seemed like the path you needed for that. So I set my eyes on medicine was going to be what I did, and that's different for me because in my family, my entire family sells cars. That's what they do. Like my brothers, my sisters, my aunts, my uncles, my cousins, everyone throughout Mississippi. And I decided I was going to do something different and go into medicine. Medicine is huge. There's a lot of different doctors I could have been and could have chosen to do. And then I don't know if I really chose to be a neurologist, or as like people say, neurology chose me to do it, right? Because I knew in my second year of medical school that neuroscience was of interest to me. Why was it of interest to me? Because neuroanatomy just made sense. And that's the story all the way through. Things just made sense. So neuroanatomy class was like, this makes sense. Pathology, not so much. So I wasn't going to be a pathologist. Once I knew I loved neuroscience, my first rotation in my third year of medical school was neurology. And I knew like in the first couple days that I was really interested in it. Number one, because I just really liked the story. I'm really into like complex stories, trying to, you know, really listen to all the facts and kind of unravel like the mystery that is there. In general, the nervous system, the brain especially, is kind of regarded as a bit mysterious, right? And then it was clear to me in my training just in medical school that there was a big need for neurologists. We didn't have a lot there in Mississippi. You know, the wait times were long. You didn't see a lot of people in class that were interested in becoming neurologists, so obviously the demand was going to be high. They were needed. And so it just, I don't know, for those reasons, all those reasons, it just seemed like something that I thought I could get into, make a difference, plus enjoy it. Because if I wasn't going to enjoy it, medicine's not easy. So if you're not going to enjoy it, then it's not worth doing. So yeah, that's kind of how just getting into neurology came. And then came the next part, which is getting into epilepsy. And so as far as that goes, I was in my residency training at Emory in Atlanta. And I was in child neurology residency. So, you know, I was already in that course. But seeing patients that had epilepsy, again, like I said about neuroanatomy, it just made sense. A lot of people think about epilepsy and one thing comes to mind, right? It's like a person like with an event where they're, you know, shaking all over. That's like what you see in the movies and television. That's what everybody thinks of epilepsy. But there's actually like a billion other points about the story of anyone's individual seizures and epilepsy. And to, you know, talk to a person and yeah, they came in and they said I had a seizure and it was an event where I was shaking all over, whatever. And then I say, okay, but let's go back. Let's really think about it. What was the, you know, very first thing that happened? And then after that, what was the next thing that happened? Because there's little bitty details of things that happen all along that then puts the story together of where the seizure started, where the seizure spread to, which helps me understand where it came from, maybe how it happened. So that, you know, understanding those stories about seizures and how they happen, where they come from, but then understanding why they happen. And that's the other kind of piece that really got me interested in epilepsy, because often the story of epilepsy is not told in a single day. It's told over, you know, years, potentially a lifetime. Sometimes you don't know the answer right away, but if you keep asking the question and keep hearing the story, eventually you put together the movie that you recognize, you know? and can kind of figure it out. And I love that, which is that's what I do every day now, is take care of those kinds of cases. I collaborate a lot in research. It's one of the areas, I think I do a decent amount of stuff. Really, probably, honestly, how I got best known is just because of the subject matter that I deal with. Not epilepsy in general, but because I deal with ultra rare epilepsies, rare genetic epilepsies. And when you deal with something like that, you're dealing with a small population of people, but generally a small population of people that have a pretty loud voice. And then that loud voice shares that with other people, and then before you know it, lots of people have heard your name and know who you are. So that's probably how I got best known. Either that or my Twitter account. I don't know. Yeah, maybe. So choosing Cook Children's was a bit of a bit of a jump off the deep end, serendipity maybe together. I don't know. I had been in academics. I'd finished my training. I was on faculty in academics and then going back into fellowship, and kind of had a feeling from my brief stint in academics that I might not like strict academics long term for a variety of reasons. But I also knew I didn't think I wanted to do private practice medicine either, because I was really interested in, epilepsy surgery. I was still interested in teaching. I was still interested in the research component, and I wasn't really sure how I could pull that off in strict private practice. So, I'm thumbing through the ads on the Child Neurology Society website, and I see an ad for this place called Cook Children's that I had never heard of. And it talked about the size of the group, the number of people in the group, talked about the epilepsy surgery that they did, their deep brain stimulator program. But then I noticed there was no affiliation with an academic place. I was like, this kind of sounds different. It's in Texas. Everybody seems to love Texas. So I was like, hey, let me go check it out. So I come to Cook Children's, check out Cook Children's, and like many people who come and visit us, they leave and they're like, "Now, this is different than anything I've ever seen before." Like just the whole feel of the place, the feel of the people, the fact that, people in the elevator say good morning, hello, have a good day, make eye contact with you, that kind of stuff. I had a different feel. And I went home. I went back to Florida where I was in training at the time, and I told my wife, I was like, I'm pretty sure this is the place. I really enjoyed my visit there. I said, now, there's a decent chance I'm going to take this job and get there and find out it was all a show and that it's really no different from anything else. But I was like, even though I've never heard of this place before, I think it's worth taking a shot. Let's check it out. And that's 16 years ago. So obviously it panned out. It's been everything I thought it was when I did the interview, and probably more, actually. Epilepsy is complex for sure. There's lots of different kinds of seizures. There's lots of different kinds of reasons for epilepsy, and so you could go all kinds of directions when you think about epilepsy. I think at its core, people have to know that epilepsy is common. 1 in 26 people will develop epilepsy in their lifetime. So, people may go around and think they've never met anyone that has epilepsy, and that's obviously not true. You have. You may not have heard from them that they have epilepsy. They might not have shared that with you, but it's quite common. For me, some of the things that are really important to me are raising epilepsy awareness. That's one of the things I spend a lot of time doing. The month of November in the United States is Epilepsy Awareness Month. We try to make a big deal about it at Cook Children's. You see the building is lit purple, which is the color of epilepsy. We have our 1 in 26 sign out front. We have, activities throughout the month. We try to light as much of the city of Fort Worth purple during the month of November for Epilepsy Awareness Month. Obviously, I wear a lot of purple because of epilepsy. So just really letting people know that it's a common thing. It's okay to talk about it. It's okay to communicate with others about it. That's really important because that's what really drives understanding and diagnosis, all right? If we think about the stories of epilepsy and kind of why, as I said, I like it so much, some epilepsies are pretty straightforward. I mean, It's fairly easy to understand where they came from, why they happened, and frankly, how to treat them, honestly. I mean, two-thirds to 75% of people will be well controlled on medications, no big deal. I say no big deal, meaning no big deal in the treatment, not no big deal in the condition. But there's a third of people about that medicines, if the first two medicines don't work, then they're not going to have probably seizure control, or at least it's going to be a lot less likely. And that's the population that I deal with. That's called drug-resistant epilepsy. And I enjoy that because, number one, of the challenge, as I said, of just kind of trying to understand why, because understanding why may guide the next portion of treatment. Because if you understand why, there may be certain medications that work very well for that reason, and you make sure you choose the right medicine. But you can also choose other treatments. So surgery, epilepsy surgery, is something I spend a lot of time doing, trying to delineate where in the brain the seizure comes from. If I can understand where it comes from, then the next question is, what can we do about it? Is it an area that we could remove or, ablate, or put a device over to modulate it or change the way it acts to try to decrease seizures? We could do dietary therapy, things like the ketogenic diet. We can do other neuromodulation devices where you basically try to stimulate nerves of the brain to try to kind of change the way the brain is acting. And then in my area now, again, rare genetic epilepsies, we're actually getting to a point where we're developing treatments to actually target the gene to cause any individual epilepsy. And that's really exciting, because if you go back to my beginning, kind of when I said, one of the reasons I was interested in neurology is, and people were like, well, all you do is name things, you don't really cure anything or treat anything. That's why I love the things I do. Epilepsy surgery can absolutely cure your epilepsy. And now to believe that we're in a space where we're developing treatments that may actually be able to change the way the gene that is causing the epilepsy functions, such that we can modify the course of the disease by doing that, basically, a gene therapy, is wild. I never would have thought that, like, when I started training. So treating a kid with a rare epilepsy is, I don't know, there's a lot of facets to it. The reasons why people, go to certain folks, right? Why do they seek me out for rare epilepsy? It's just for that reason. It's rare, right? So the fact that I've seen one, maybe more than many other people have seen, right? So, there's an experience factor. And I'll tell you, the way rare disease works is, once you've seen one, if their experience was good, they'll hit the social media and tell people, like, hey, this person knows a little something about this, you should see them. And before you know it, you see a lot. I always tell a story. I've got this one group of patients I see. The reason I see them is a dad sent me a message on Twitter. It was like, will you see my kid, that has this condition? I was like, well, I will, but understand, I'm not an expert in that condition. I've never seen anyone with it. And he was like, oh, don't worry, you will be an expert. And I mean, sure enough, like, after they came, like, I've seen multiple other kids with the condition. So they build their own experts as needed. So part of it is just having some knowledge of it. The other part is really important, is understanding that epilepsy is more than just seizures, especially in these conditions. These developmental and epileptic encephalopathies, these kids don't just have seizures. They have, maybe learning or behavioral problems, sleep problems, GI problems, troubles with walking and ambulation. So there's a lot of facets of things that have to be addressed. And so that's a piece of it. A piece of it is just being able to connect to the family, and then connect the family to other families, because probably some of the best knowledge in rare epilepsies and the best guidance they get is not going to be from me. It's from other people who are dealing with the same things they are, because they're gonna have the lived experience to be able to share with them. My job is to kind of help them take those lived experience and figure out which one maybe makes the most sense for them. So yeah, I mean, there's a lot about it. It's it can obviously be, epilepsy in general can be scary, but a rare epilepsy probably even scarier, because there's, you got a smaller population of people that are living with it. But I'll tell you that they're strong populations. They don't mess around. I mean, I've never seen people they come together so quickly to try to solve the problem. They all unite behind this diagnosis to try to get answers to it, and it's pretty impressive. I see some impressive families that come in who have done a lot of work before I ever see them. I often tell, my people that train with me, students and whatnot, you have to understand when you take care of these conditions, when you walk in that room, you are not the person that knows the most about this disease. That mom, that dad, they know more about this than you do. They're funding the research into this condition. So just be prepared. You're just there to help. There are a lot of misconceptions about epilepsy surgery, I think. Epilepsy surgery, unfortunately, is often, many people think of it as like a last resort treatment, and that's probably the worst way to think about it, because the sooner you do epilepsy surgery, oftentimes the more likely you're going to have a better outcome. In epilepsy, once you fail 2 drugs, 2 appropriately chosen used drugs, if they don't work, they don't render you seizure-free, you have drug-resistant epilepsy. So at that point, you should be evaluated by an epilepsy center, an epileptologist, to see, like, what are your other options? And surgery may not be the option for everybody, but it's definitely one to consider. But as I said, it often gets pushed off, unfortunately, because of misconceptions. People maybe don't recognize, like, who's a good candidate for epilepsy surgery. As I tell people, everyone's a candidate for epilepsy surgery. Some people are just better candidates than others. There's misconceptions about its safety, right? When you think about brain surgery, that's a big deal. And I'm not saying it's not a big deal, but it's actually incredibly safe. It's really safe such that it shouldn't be a last resort kind of thing. There's a lot of like cultural barriers and things like that to epilepsy surgery. But understanding those kinds of things and being able to kind of talk through it along with all the other options. That's what I tell people. Like, my job is to show you all the options available to you and the risk and benefits of all of them, and then together we'll make that decision of like what makes the most sense for you. Maybe surgery, maybe something else, but you need to at least know the option. The Institute for Mind Health began as an idea long before I came to Cook Children's, honestly. The Neurosciences Center was kind of here when I got here, and that was the neurology, neurosurgery, and neuropsychology were all working together at the time, and really created like a really good environment for patients, because they could see multiple providers on the same day, because often the patients we take care of do need a neurosurgeon and a neurologist, for example, so they could see the doctors on the same day, but they also just knew their doctors were like basically living together in the same room, so they were able to talk to each other and kind of converse about their cases, and you just get more rounded care through good communication, right? So the thing is that that's only 3 specialties, and honestly, there's a lot of other specialty providers that our patients often need, right? They need many times developmental pediatricians or psychiatrists or psychologists or physical medicine or rehabilitation, and so a long time ago, people started talking about, it would be great if it wasn't just the 3 services, but we had all of the services somehow together, so we could kind of, interact and kind of improve care well. And so I kind of, it wasn't my idea, but the group was interested in it. There was interest in it, and so I kind of took that on as something to help kind of shepherd through the Cook system to get that project done, and now we've got it. So now we've got, the 4th floor of the Dotson is the Institute for Mind Health, and you got neurology, neurosurgery, neuropsychology, but you got psychiatry and psychology and developmental pediatrics and pain medicine and physical medicine and rehabilitation, and the research team. You got everybody up there, and even if we're not seeing the same patients on the same day, we're seeing each other every day, which is incredibly useful, because you don't know how many times you kind of see somebody in clinic and you're like, I'm not sure what to do about, whatever. And I can just run into my colleague in the hallway or just walk down to their office and say, hey, so I bother you for just a second. I just saw this kid, and here's the thing. Like, what would you do in this situation, So it's really creating a really nice kind of collaborative environment where I think we're going to see like continued, like improved care for our patients, ultimately more convenient care because they can get to see more people in a day, get everything knocked out with one trip to the campus. Hopefully increasing understanding of these conditions and this interdisciplinary care really helps. So it's an exciting thing, and it's a novel thing. You don't really find other places that have that many of the specialties under one roof together every day. So the Institute for Mind Health started as an idea from people long before I came to Cook Children's. I think it took a back seat. They kind of created the Neuroscience Center, which was neurology, neurosurgery, and neuropsychology, and that's kind of how they practiced for a while. And then when I became the medical director for neurology, I kind of approached the job as like, how was I going to take? I mean, I loved the practice, and they were doing great work. So, I sat down with them for a vision planning. I was like, how are we going to take this good thing we've got and make it great? Like, what's the next step here? Are we at the top, or can we do better? And we came up with a lot of things in that meeting, but one of the things, and kind of the pinnacle of that meeting, was we ought to have a neuroscience institute that has psychiatry and psychology and developmental peds and all that kind of stuff. So that's kind of where it started as an idea. And so as medical director, first I focused the attention on the neurology department itself, growing the faculty, growing the services we offer, growing where we offer the services, that kind of stuff. But once all that was taken care of, once it did all that, we developed the research center, et cetera. I was like, well, the last thing on the list is this Institute for Mind Health. It didn't have that name at the time, but this Neuroscience Institute, let's start working on that. And then that kind of started the process that ultimately, gave birth to the Institute for Mind Health. I've always loved art. My mom is an artist. I mean, not professionally, but like, she's creative, and she's an artist. She does some great stuff, and she always collected art. She's got the same problem I do, that she's got too much junk and not enough walls to put it on, right? And art is just it brings joy, right? It's fun to look at. It's fun to kind of interpret what it means to you, or what kind of feelings it gives you. It's fun because it can share a story. If it's not, your own story, what you interpret from it, it's the story of where it came from, who made it. Cook's a beautiful place. It's got a great look to it. Everybody that works in my department will tell you, like, one of the jokes I say is, I don't like art with animals doing human things. It's just, I'm against that. And I'm against mass-produced art. Like, I wanted like novel, fun things to make the Institute for Mind Health different. And so that's kind of where the first idea of, like, let's get an art collection that's like just unique to us. It's no one else has the pieces we have, right? That was number one. Number two was that I had become familiar with a lot of people who are in the neuroscience space, either because they have disorders of the nervous system, or because they are doctors or researchers like me, but they also happen to be artists on the side. And so I was like, let's get a collection that is by those people. It is a neuro-focused art collection, and that is what the collection is. So if you go around our lobby and you look at the individual pieces, you can actually go to the website and learn about the different artists. We've got a huge mural, right, that was painted by John Brantlett, one of my favorite local artists here. John has epilepsy, and John is visually impaired, and he painted a 15 by 9 foot mural by touch. So if that doesn't, first of all, just make you love it because it's a beautiful piece of art, to understand what he's able to accomplish is a story that I hope resonates with our patients, their caregivers. We have other pieces. There's a lot of wood carvings that are things like a horned frog and a longhorn and a bear. And they're all made out of brain cells. So you see a bear, but if you look at it, it's made up of Purkinje cells from the brain. And so what, pieces of art like that do, hopefully, is spur that additional conversation. Yeah, it's a pretty bear, but man, what's it made out of? Oh, it's made out of these Purkinje cells. Well, what are Purkinje cells? Well, Purkinje cells are found in the cerebellum, and so it creates that kind of conversation. The nervous system is a work of art, so why not have the lobby full of neuroscience art? I don't know. No, I strongly believe art has the ability to help and heal. I mean, it's no way to express yourself, express your emotions. Right? We've got one of our pieces in the collection is by a patient of mine who had epilepsy surgery. And if you kind of read her story, she'll tell you about that piece of art and how it expresses her story. It's a rainbow. It starts off, in a thunderstorm. That was really her epilepsy. And then you see on the rainbow, you see, some folks holding umbrellas that are triangles. That's Cook Children's that kind of like took care of her and then kind of brought her to the end where the sun is shining, and that was kind of that was her experience, and that's kind of her expression of her experience. And that was a good way for her to tell her, her story and how well she's done and how she's gone off to live happily ever after, seizure-free, off medicines, getting a master's in psychology and hoping to come back and work for the Institute for Mind Health. It's it's great. Art, whether you're good at it or not, is good for you. I mean, when I think about my proudest moment at Cook Children's I don't know, that's a hard question to answer just because I've had a lot of things that I'm proud of at Cook Children's. I am proud of what I've been able to create as far as just my career, what I was able to do at Cook, because Cook was as supportive as it has been and given me the resources to do what I do, but to create, kind of my genetic epilepsy program and to be now kind of helping lead some of these clinical trials that are developing these drugs that can alter these, we hope can alter these diseases that just a decade ago I would have told people you can't get seizure control on this and it's not going anywhere, in your life. That's awesome. And I know we've got a long way to go, but that's really exciting. I think another big proud moment is creating the neuroscience research endowment and getting that going. When I came to Cook, as I said, I'd never heard of it. One of the reasons was not because Cook wasn't doing amazing stuff, but what I found when I came and kind of interviews, you had all these people doing great stuff who were just happy doing great stuff. They come to their job, they do their job, and they go home. They weren't necessarily always sharing it kind of wide. And I was like, why are we not? There's too many opportunities here. And I just saw with all the patients we saw and all the stuff we did, so much opportunity for research, and just knew we needed some people whose sole job was to do research because it was difficult for the clinicians to do both. And so by creating that neuroscience research endowment and then bringing in this team of researchers who have been doing just amazing work and setting up amazing collaborations that really just feed back to help our patients, that's been really special to me, because I think that unlocked an area that existed at Cook. Research existed, but I think it unlocked another box of research at Cook Children's that has really, I hope, shown a whole nother level of potential of the place. And importantly, not just to do research, but to do it differently, which is what we do. Like everything at Cook is kind of done differently. And so the ability to do it differently like we're doing is really good. Other than that, I mean, we've done, my new position is Vice President of Faculty Development. It's young. I'm only like 3 months in, but what I see there is another real potential to create some stuff to be proud of, and proud of not stuff that I myself have done, but being able to help other people on the campus who have great potential, and just helping them navigate our system so that they can get the most out of their ideas and the most out of their potential and bring them to fruition. I'm thinking that's gonna leave me with lots of things to be proud of, to know I had at least some part in helping get those things across the finish line. Research is incredibly important, right? And until we've cured all diseases, we're going to need research, basically, right? And yeah, we've got good treatments, but we can always get better treatments. And research is an essential piece of, we practice medicine. So it's practice because we don't exactly know the answer all the time, right? So research is part of it. And honestly, for anybody to think that they are practicing medicine every day and not doing research is kind of laughable, because we are. It's just a matter of whether you formally collect the data and try to analyze and do something with it or not. So super important to kind of get the answers we need. When we created the Neuroscience Research Endowment, kind of the directive of forming the Neuroscience Research Group is that the work they did had to have near-term benefits to the patients we care for. Like, it really we needed to be able to take what we were learning and apply it to make the kids we're caring for better. So that's what you see in some of the work we do now. We do a lot of work around imaging biomarkers and trying to better localize where seizures come from, because that directly impacts how we do epilepsy surgery. Or the clinical trials that I do I choose them because I have populations of patients that have those conditions that need better treatments, and by helping do that research, we can get those therapies to them. It's a big operation. Obviously, I am one of the pieces of the neuroscience group. I'm one piece of the Institute for Mind Health. The Neuroscience Research Center is made up of PhDs and postdocs and students, medical students and PhD students. We've got clinicians that are involved. We've got some involvement from almost every specialty within the Institute for Mind Health, and we just continue to build out those neuroscience research teams that are interested in kind of different areas, and creating work around it. Like I said, hopefully it has near-term benefit to the patients, but then also brings, some further recognition to Cook Children's that we're not just, taking good care of people with the tools we got, but we're developing some new tools to take even better care of them. As it relates to the future of research within the Institute for Mind Health, I think, there's so much potential left to be unlocked. Like right now, we have teams that are, focused in epilepsy, movement disorders, stroke, autism, some amount of mental health, but we really want to build out into mental health more. So building out teams into that, building out teams into neuroimmunology, for instance, neurogenetics. There's so many facets of neuroscience that we can continue to build out teams to investigate. So I think sky's the limit on that. I think even bigger and more important to me is that I think there's another level of potential that's going to come to Cook Children's and research, because I hope what we have done in neuroscience by showing kind of a blueprint for how this type of research could be carried out at Cook Children's, how you can do all the kind of academic research work that you would see in a big kind of academic institution, but you could do it in a Cook environment. I hope we can now take that blueprint, just replicate it, because we've got amazing clinical stuff going on at Cook Children's in every specialty, and every one of them could do the exact same things we are doing with this model. And I think we're going to see that in the next, decade, a real growth of that kind of research across the Cook Children's campus. Again, being done a slightly different way from what people are used to, but a way that is beneficial to the patients and beneficial to the people that take care of them, and further puts Cook Children's on the map. So when I came to Cook Children's and I took the job of medical director, I said one of my goals was that I never wanted to go to a conference and to have someone ask me where Cook Children's was. And I feel quite comfortable now that I very, very rarely ever run into anybody at a conference that I would go to that doesn't know where Cook Children's is. But, I'd like to see that across the board. As much as I have accomplished and as much as I want to accomplish before I'm done at Cook Children's, my family has been a big part of it. They put up with a lot. They put up with a lot of me not being at everything, right? Today's a fine example, actually, because I'm missing a high school cheer competition because I'm doing this and a couple other meetings. Hey, no fault. Well, they put up with those things. Most importantly, they put up with hearing about my work all the time. My daughters, my wife will tell you that they know probably everything about the Institute for Mind Health because they heard about every inch of its construction from the beginning to the end. They hear about kind of every frustration and detail, but they're always supportive and give me other things to think about when I get home, other than work, which is good to kind of rejuvenate me to go to work. They're and taking a little bit maybe of what I've done maybe and applying it to themselves. My oldest daughter's a nursing student at TCU, wants to work at Cook Children's when she's done. And the youngest one going into marketing and advertising, which is my second favorite thing to do besides medicine. So hopefully they've listened to all that stuff I've said over the years and at least gained something from it other than just having to listen to me. 25 years ago, when I decided I wanted to go into medicine and neurology, I never would have thought that I would have gotten to a place where we weren't just making diagnoses, but we were really changing genetics, curing things, really altering disease paths and changing lives. So couldn't be more satisfied that I chose to become a child neurologist and an epileptologist and spend my career doing that. That being said, 16 years ago, came to Cook, a place I'd never heard of, had a hunch that it would work out, but wasn't sure. And I can say without doubt, the best decision I could have made. I've had opportunities to go other places. I've had opportunities to have other jobs. All of the things we have done at Cook Children's could have been proposed many other places, and I don't think any other place could have pulled it off like we did at Cook Children's, which is the reason why I stayed, never left, and never will, given the support and how successful it is and the potential of what we can do in the future. It's just I say it's a magical place. That's so cliche, but there's no place like it. It's great. I love it.